Okay. Hey, Crosswalk. This is Pastor Mike RHYNUS here, and I'm joined by Dr. Chad VERCIO, and we are here to do a update on what is happening with all things COVID related. And hopefully you had a chance to tune in and hear from Dr. VERCIO when he and Pastor Tim shared some time together a few weeks ago, but a lot has changed since then. So Chad, thank you so much for being back with us. I know you've got a lot of great things to share with us tonight, so I'm going to turn it over to you.
Sure, happy. I mean, I know this has been a confusing situation for a lot of people, especially if you're not in healthcare. I think it's probably been equally confusing for those of us that are in healthcare, just to kind of see how this progressed or, hasn't progressed, how we thought it might. Fortunately. And so, yeah, hopefully you can shed some light through this discussion on why the things have gone the way they've gone and maybe help people understand that a little bit better.
That sounds
So
good.
I'm going to go ahead and share my screen so you can see, what I put together, a few slides. And so can you see that?
I've got it here.
So I guess we'll start at the end with what's normal, but we'll go back to the beginning.
There we go.
So here's our COVID update. So, what we're going to cover tonight, or I guess it's tonight our time. You may be seeing this any time of day, who knows? What we'll cover is, hospitals aren't busy and why that might be. You probably have seen stuff like that on Facebook or other, forms of social media or in the news. And it's confusing because, people were worried about hospitals being overrun. So, and then what is the current status of COVID in our area? And then the big question, which has been pretty much dominating the news for the last week or so, is when can things get going again, or when can we, quote, reopen? So those are the things that we're going to kind of cover. May not get as specific as probably some people would like, but hopefully we'll talk about some of the principles for that last one. So yeah, hospitals aren't as busy currently, and that's really across the board unless you're probably in some of the hospitals in New York City or New Orleans. And so you, like I said, you've probably seen this, around the country that various hospitals are just not busy. And that's in a sense, probably a good thing. We could think of hospitals as potential areas where people could go and get infected or transmit this. And so keeping them as light as possible has been a good thing. So a lot, pretty much all hospitals have canceled elective types of cases, and that's kept a lot of people both out of the operating room and then therefore from being admitted. Also, there's a lot less things like trauma and other things happening because people aren't driving as much. And so the ERs are a lot less busy. And then there's also people that, normally might seek care for a cold or something like that in the ER and then aren't because they're worried about getting exposed. Sadly, this has led to actually some people delaying care when they really did need it. And so there's been a few cases of actually kids dying in Orange County because they failed to seek care until it was too late. And so really, be wise about this. If you really do need medical care, then get it. There's all kinds of resources available for asking questions like that. There's nursing hotlines. IHP, if you have IHP, has a hotline. Many insurance companies do. Most physician offices do. And so please at least get advice. And if they tell you to go to the ER, then you really should go to the ER. They'll try to, I'm sure, be wise as far as their recommendations for that so that they don't necessarily increase your risk. But please do get emergency care if you need it. So anyways, that's part of the reason why hospitals aren't busy. The other reason is that we have fairly effectively flattened the curve in California and probably in other states. They prevented the curve they prevented a big peak by shutting things down early. And so this has created a lot of capacity. At some hospitals in the local area, they were looking at increasing the capacity for ICU beds by basically 200%. So planning for, one of the hospitals that I work at, we have a total of 36 ICU beds, and we were we had plans to increase that basically to 90 and then potentially 180 beds. So really, you know, over tripling our ICU capacity with the plans. Now, fortunately, we haven't had that happen, but the, you know, less beds occupied by other kinds of things creates that capacity if it were to be needed. So that's one of the big reasons, you know, that canceling those elective kind of surgeries was important, just in case we did see a big surge, and then also preventing the transmission. So I don't know if you have any questions kind of about that, Mike, that we're talking about this.
No, I just really like that insight as, yeah, things have died down so much that we're not having so many critical or trauma cases. I hadn't even thought about that, but I like that.
Right.
And yeah, definitely wise. I love the wisdom there of if you're in need of support, make sure you get it. Thank you for sharing all that.
Yeah, that's really, really important for people to know.
Mm-hmm.
Generally, you know, if you do need emergency care, they're doing what they can to try to decrease risk of transmission from somebody that would have COVID to other people that are, you know, wouldn't. And so your likelihood of picking it up in the ER is not real high. And so, yeah, if you need emergency care, make sure to get it. So,
That's great.
okay. So as I said, you know, just a couple of minutes ago, we have, you know, fortunately flattened the curve here in Riverside County and San Bernardino County. Also, it looked like the peak wasn't hitting quite like people were possibly expecting. And so I think I showed this graphic in the last interview or discussion that I did with Pastor Tim, but this shows, you know, how different the curves can be. And so with no protective measures, you can see in the kind of teal color for Riverside County, they were projecting huge numbers of cases, very rapid increase in cases. And that would have been, you know, pretty devastating to Riverside County. And this is where, you know, I think people saw some of the initial statistics that were presented or projected, and were kind of confused by them in retrospect. So, you know, the Imperial College in England had projected potentially 2.2 million deaths in the U.S. as a result of this. And then there were other projections that was anywhere from 1 to 4 million. And that was really before there was any social distancing, or what I think is probably more appropriately called physical distancing, but any physical distancing in place, any other mechanisms of decreasing spread. And so, you know, that is one of the big reasons that we've seen a significant decrease in those projections. It's not necessarily that people were wrong or the quotes models were wrong. Initially, it's just, you know, that these things have been more effective than probably most people anticipated. And it also is, you know, these kinds of projections are really, really challenging to quotes get right, or to be accurate. First of all, this was a very unknown pathogen or virus. We didn't know very much about it. We didn't know, you know, in general, its incubation time or how long it takes to go from getting the virus, you know, into your body to developing the infection. We didn't know that you could spread it asymptomatically, and all these other factors that were really making it challenging to predict or project. So anyways, you can see here that if we had no protective measures in place, the doubling time was, you know, anywhere from 4.6 to 4.7 days. And at the early stages of the infection, actually, it was even faster than that. I believe it was down as low as 2 days in some countries at the very start of their cases. And we were in Riverside County, we were actually at a 4.6 days doubling rate for multiple weeks until not this last Friday, but the Friday before. We were still at 4.6 days, which was quite concerning. Fortunately, that Friday we started to see a slow in that doubling rate, and then now we're, you know, last week it was about 8 days, and then now it's looking at like it might be as long as 11 days for the doubling rate, which is really, really positive. And so you can see that we're probably anywhere from 18,000 total cases in Riverside, with about 3,200 admissions and maybe around 360 deaths, to hopefully on the lower end of that in the red. And so those are pretty significantly different from the yellow and teal colors for projections. So, you know, that's overall positive, but it also explains, you know, why people aren't seeing these huge numbers in this area. and aren't seeing, the hospitals completely full.
Well, yeah, I remember you and we talked a while back about just county preparedness, and we were talking about San Bernardino County. You're mentioning that um, things were not looking good early on, and I'm so glad to hear that everybody has been doing their part for the most part and have flattened things out. I'm eager to hear more about what we should continue doing. I don't want to jump ahead, but yeah, these statistics, and this is good news, I would say. So glad to hear this.
Yeah, I think it overall is good news. It does make things quite challenging, for hospital administrations because,
Hmm.
when the hospitals aren't full, then that is a cost. And so I know that's been really, really challenging for multiple organizations in the local area.
Yeah,
Yeah.
absolutely.
So, you were just mentioning, why that we want to really try to avoid, peaking up again. And this is a graph from Michigan, and you can kind of see this initial peak, which is probably what we're in right now. We're somewhere around the peak of that, at least in Riverside County. San Bernardino might be a little bit behind. They haven't had probably quite as many nursing homes have the infections as Riverside County, although there definitely have been some. And so what you don't want to have happen is reopen things too quickly and then have this second, really big peak. And so this really shows why it's important to be very careful and probably in some ways conservative in the way that we reopen things up. We'll talk a little bit more specifics about social distancing or physical distancing and that kind of thing. So this shows how quickly kind of the doubling rate for different states, and you can see here there's New York and California, and California fortunately has been doing significantly better. I don't know that that's necessarily a difference in the leadership between New York and California, although I do think that California as a state has handled this actually pretty well compared to some other states. I would say that some states out there are getting very lucky so far in the way that this has kind of gone about in their states because they were very late in implementing any kind of physical distancing measures, kind of lackadaisical about it, or really kind of not caring about it. And so they're, in a sense, I think they're just lucky they didn't have very many cases at that point. But anyways, I think California has handled this pretty well overall and was actually one of the drivers for that early masking policy. So people wearing masks in public places and really kind of led the nation in that. So I
Oh,
think that's
good.
one thing that we can be thankful for. So this
Hmm.
looks at Riverside County, and we've had 33,000 or nearly 33,000 people tested. This was as of yesterday, and then about just 2,500 people confirmed. 223 were hospitalized as of yesterday, and that was 71 in the ICU. And then we'd had just over 70 deaths. So obviously that's probably expected to go up a fair amount over the next couple of weeks. One of the things that makes the deaths challenging is that, we talked about last time, the incubation period can be as long as 2 weeks. So, potentially you could get infected today, not start to have any symptoms until 2 weeks from now, really start to have some symptoms then, and then a week later, potentially get hospitalized. And then a week after that or more, for somebody that had a bad outcome, potentially die. So it really is a very big lag time from when somebody might get infected, which can explain, why even very early before there's a lot of cases, it's really important to decrease the risk of people getting infected through the physical distancing kind of things. So
Absolutely.
San Bernardino County, not quite as many cases. Overall, the positivity rate is about the same, 10 to 11% between the two counties. And San Bernardino has 57 deaths so far. So like I said, San Bernardino is probably a little bit further behind the curve. That's because Riverside County kind of had an outbreak in the Coachella Valley fairly early on. So this is a site I've been following pretty closely, nearly daily. And if, I don't know that I would encourage everybody to look at this website daily because it's kind of morbid and
Mm.
might be a little discouraging or create anxiety or that kind of thing. But it does have some interesting statistics. And so you can see here, I pulled out some of the, top countries so we could kind of compare them. And, USA is at the top, and then Spain and Italy have been hit particularly hard. France has been hit relatively hard as well. And then Germany
Mm.
actually has not been hit that hard. And the things that are interesting on this page, of course, looking at the total cases and total deaths is a little bit interesting. But the things that I think, are probably interesting is the serious to critical. So this is a predictor of, potentially how many future people might die, unfortunately.
Wow.
Once people are in the ICU and on a ventilator or other kinds of things, they have a very, very high mortality rate, unfortunately. And that's, because of a couple of different things. There's several different ways people can die from COVID. One is just from the respiratory, disease in the lungs. Another one is because of the cytokine storm, or basically where their inflammatory response just goes into overdrive. And then also they can develop microthromboses. So there are, potential ways to attempt to treat all of those. But once you're in the ICU, then and need a ventilator or have one of those other issues, then the mortality rate is unfortunately very high, which is different from flu and other kinds of viruses in general.
Mm.
And then the other one that I find very interesting is kind of the death per millions. So, if you look here, the US is about 123 deaths. And then Spain and Italy have been hit particularly hard. And then France has actually been hit fairly hard as well. And so Germany, however, hasn't been hit very hard. And we don't exactly understand all of this. There's a lot that we don't understand about this virus so far. Probably part of it is genetic. Some of those things that are occurring, whether it's the severe respiratory issues or the cytokine storm, really may be somewhat a genetic issue that we just don't know about yet. Also, Italy definitely did have an older population compared to the rest of Europe. So that's probably part of the reason for their issues. So anyways, there are significant differences. Germany, probably one of the reasons that they've been successful about it is they really deployed rapid testing and widespread testing pretty quickly. And so if you look, and then I'm guessing along with that, they have some of the other things that are really important, like contact tracing, or be able to trace who people have been in contact with if they do have the disease, and then have those people quarantine. And so if you look, they've done 20,000 tests per million population, whereas we've done only 11,000. And so they pretty rapidly scaled up their testing, and my guess is the other public health measures, which has really kind of helped them decrease the number of deaths per million people, is one of the things. And so then the UK, interestingly, also has a much higher death rate than we do. And part of that may be due to their late implementation of social or physical distancing measures. You may recall that they were fairly lackadaisical about this. And actually, the prime minister got COVID and nearly died from it. They had started to take things seriously before that, but they were pretty late in the game as far as instituting those things. There's another country that I didn't include that people may be thinking or pointing to, which is Sweden. And a lot of people have, pointed to them as a different way of approaching this, where they've not, shut down things widely, but have recommended that people that are high risk shelter in place, essentially. And we'll see. They've been kind of a little bit above us in the death rate. We won't know really until this is over whether that was a good strategy or not. I think with our testing capacity, we had to do what we did because of the limitations in our testing capacity. So, all right. So that's probably the things to know about those stats. So when can life go back to normal? I think this is, a lot of people's questions. And I would say it really relies on, the things shown in the pictures here, which is testing. Rapid, widespread testing are some of the most important things for really allowing us to kind of reopen things, and doing that wisely, instead of just kind of just saying we're going to go ahead, regardless of the consequences. So one of the documents that's out there that I thought was really well put together is by AEI and the National Coronavirus Response. It was put together in part by Scott Gottlieb, who was the FDA commissioner for a while. And they had, I thought, some very wise recommendations. You can, if you just go to this website, you can read through kind of the bullet points. You don't have to read through the whole document. And if you do open the document, in the first part, introduction, they give kind of an overview, which is very helpful. So, I'd encourage you to read through it. But basically, he lists out 3 phases. And, part of the thing that's important to know, we're going to look at a couple of other documents or ways that people are thinking about this. Probably don't focus on the names of the phases because everybody's using different terminology for the different phases, but focus on what those phases mean. So for AEI, phase 1 was basically slowing the spread, which is what we're doing now. We did all these physical distancing measures to really slow the spread, allow us the time to increase our ICU capacity and hospital capacity. At the same time, hopefully increasing our PPE capacity, because that's been a significant difficulty in a lot of the other countries, and increase our testing capacity, and then implement some surveillance systems and contact tracing and isolation or quarantine. So we have done, all of these to varying degrees of success. So, as I mentioned already, PPE has been a big challenge in various areas of the country. Fortunately, in our areas of the country, it hasn't been as much of a challenge, which I am very grateful for. Increasing ICU bed capacity, I think we've done that pretty effectively in our planning at this stage. But this doesn't just relate to beds. So beds are a big thing, monitors, it's any kind of equipment that is necessary for ICU level care. So most commonly people think of ventilators, which are certainly an important component of ICU level care, but there's also pumps for medications. There's actually the medications themselves, which have been in significant shortage. And so, it's kind of scary, but we've had to talk about like alternative ways to intubate patients without sedative medications and things like that. And so there's all kinds of things that go into that besides just the bed. And then we've also, been working on testing capacity, although I think that's been one of the things that's disappointingly been fairly delayed, and I think could have been coordinated at a federal level a little bit better. But yeah, we really have been working at increasing the testing capacity. And you've probably heard there's, very rapid tests that are tests that turn around very quickly. And I'm not going to get into all the different names, but there's a lot of different tests, and some of them do come back very quickly. The problem is that those are fairly limited in supply. Not necessarily the machines. Well, the machines are too, but also the reagents and even the test kits are very limited. And so it doesn't do you any good to have a machine that can turn around tests really quickly if you can't actually collect the samples to do the tests with. And so, that's something that I think will be significantly better probably a month from now, which is sad to say, but that's one of the things that is really kind of holding things back. The other things for surveillance, we do have some public health, degree of surveillance, although I would say that, if we were to have much more increase beyond where we are at, I'm guessing that would significantly overwhelm public health capacities as far as tracking and doing the tracing and then ensuring people are doing isolation and quarantine. And so, all of these things are things that would be important to really have a successful reopening, quotes reopening. So for AEI, they labeled the next phase, phase 2, which was really reopening most things. And this would be state by state and at an incremental level. So right now we have gatherings of 10 people or less, right? So we would, potentially gradually increase that, with guidance from the state and the local county public health officials, and basically increase that up to 50 potentially, and then beyond that. And so it could be actually, unfortunately, quite some time before we could meet, as a full crosswalk body for something like this, because the risk of transmission to a large number of people is significant when you're in an enclosed space, especially when you're doing things like singing. So, we were talking about this choir in Seattle that they had this was early in the Seattle outbreak, and they had 45 members of the, no, it was 60 members of the choir, I think, if I remember right, and 45 members of it contracted COVID, even while they were singing in social distancing fashion. Apparently they were 6 feet apart, and 45 of the 60 people contracted the virus. And that probably goes to say that if you're doing anything that's increasing your respiratory rate, increasing how forcefully you're exhaling, that's putting that virus out there further, and then increasing, the exposure to other people if you were an asymptomatic carrier. So anyways, in order to start with phase 2, what they really recommend is that all of the above things are in place, and that there's a sustained reduction of cases for at least 14 days in that area. So, we may not have, full, ideal state testing capability before we, start to reopen things, but we are significantly better than we were 2 weeks ago with testing capability. And so I think that, likely we're going to start seeing the quotes reopening of things in the next couple of weeks. And just as it says, it's determined state by state, and probably even more county by county. And so you're going to see this, happen differently all across the United States. Phase 3 is return to relatively normal. And for this, they, recommend all of the above things in place, and then really no significant cases at all with potentially a vaccine. And then they do have a phase 4, which really involves preparing for future pandemics. So there was also federal guidelines, of course, appropriately named Opening Up America Again. Had to have some branding, I'm sure, there, along with other federal statements. So, and overall, it's actually fairly in line with what I just talked about. The one thing that I think would have been nicer for the federal government to do is take a little bit more responsibility for the testing capacity. Unfortunately, they've kind of left that state to state of the states ensuring, testing capacity, ventilator capacity, all those kinds of things. The federal government has really kind of lagged in leading, it seems like, on these kinds of things. So anyways, you can find those guidelines, and they're worth reading as well. I think overall they're pretty good. California, Governor Newsom also released a plan, I think it was 6 days ago now, and basically very in line with what we've already covered, but widespread testing that would allow the state to isolate and trace people that have come in contact with somebody that was positive. Then an important thing that they can, the state and the health system can care for older and medically fragile Californians. The hospitals can handle a potential surge with a relatively and at the same time resume to normal preventive and other medical care. So we're not having a massive peak, but maybe a lower grade, peak. And then the identification of promising treatments, development of guidelines for businesses and schools that would kind of allow physical distancing as things reopen, which, as you can imagine, would be really challenging in schools, especially with young kids that may not understand. So older kids, probably after the age of 8 to 10 probably can understand this a little bit better, although it'd be real hard on the playground. But younger kids, just they don't get it. And the creation of a data tracking system that would allow for an early warning if the state, had to reinstate a stay-at-home order. One thing I didn't mention in covering the AEI scenario is that they talk about specifics of going back to phase 1. That was actually one of the things that seems to be left out in the federal guidelines. Is they didn't really address if a state or local area were to see a resurge in the number of cases, how should they respond to that? to what degree, should they respond to that, or to how many cases would it need to be before they institute shelter-in-place orders again. So that's kind of California's plan. And so the question that we kind of started is, what's normal? Are we going to get back to the way that life was before, this all came about, back to say January or December? Probably not for quite some time. But what I've been really, really encouraged about is there's so many other ways to connect with people. There's so many, and we can do this, I think, fairly soon in small groups. I think it's been challenging to have kids and not have other outlets for those kids. And so, I think we're likely to start being able to do that very soon in small groups and of less than 10 people. And having said that, it probably would be wise to not, spend a group of 10 people one day and then 10 people the next day, different 10 people the next day, and so on, because that would make it tracing really, really difficult if somebody were to develop the disease. But, your family, real close friends and things like that, it's probably, safe to start doing those fairly soon when the state is kind of seeing a sustained reduction of cases in the local area. So I don't know if that covers kind of the questions you might have had, other people might have had, but of course, people are welcome to shoot questions to you that you can then forward to me, and we can kind of work to respond to them. I don't know if you had any other questions, Mike.
Oh, thank you so much. That's really good. It's encouraging to hear that, maybe broadening the circle a little bit to your immediate family and kind of keeping a close eye on who you're associating with as things lessen. That could become the next step. I'd enjoy that. Yeah, you're right. Having kids and being limited to this confined space of a home is challenging. But one thing I was going to mention as we were looking at the different phases, maybe you saw this already, but earlier today, I think the governor of Tennessee said that by April 30, they're going to be lessening their restrictions. And so I don't know if you had any thoughts on that, but I was, I guess, surprised.
Yeah, so several states have started to do that, generally in the South. And I haven't followed their case numbers closely to know, what their local situation is and what their doubling rate is. Are they actually starting to see a decline in the number of cases? I will say that some of the states in the South have been fairly aggressive. Tennessee, actually, I haven't followed them closely, but it seemed like they've been kind of moderate in this. I would say Georgia, it seems like has been really aggressive about this. And I don't know, I question, I guess, that approach. But I don't know. I think, it is really important to be careful. There's definitely lots of things to worry about from, keeping things closed too long. Obviously, this is a huge strain on businesses, and so don't want to deny that by any stretch of the imagination. But it would be a bigger strain if we open things too early and then have to, potentially shut down again. That's, that would be even more devastating than keeping it closed just a little bit longer to where cases are really declining and the testing capacity is there. So I don't know. I mean, I don't know the specifics enough on Tennessee to answer, whether that's wise or not. But, I would say if they're following the principles that we talked about in the kind of some of these documents, then, that may be wise. That would be wise probably if they're following those.
Well, yeah.
Oh, go ahead.
No, I was just saying that's good info. That's good things to keep in mind. I want to ask another thing, but go ahead with what were you going to say next?
Oh, I was going to go back to the idea that this is really challenging for people, and specifically, I would say for parents. Amy was telling me a joke that she'd read or something that, unmarried people or people without kids are like, during this time, what 10 hobbies can I pick up? Or I need to pick up 10 hobbies, to keep myself busy. Parents are like, man, I'm so grateful for those 5 minutes of rest between 10:55 and 11 p.m. and this is really, really challenging for parents. So, One thing I would encourage you to do is there are some organizations that have put out some good things for kids to do. Also, if you have older kids, there's a really interesting guy. He'd actually come to Loma to do our faculty development on generational issues. His name is Tim Elmore. And he had a really interesting a blog post called "A Pandemic is a Terrible Thing to Waste," and really kind of helping us think about, how can we help our kids learn from this? It'd be terrible if they went through this and didn't learn anything. And so how can they learn from this? And I thought it was pretty interesting and very helpful. And then one of the things I like to, mention is Love and Logic. I think they've got a lot of good stuff, and they also had some stuff on this situation as well, and how to consider dealing with your kids in this situation. So.
Wow, that's really good. The name of the guy again, Tim Elmore, is that correct?
Yeah, Tim Elmore. Mm-hmm.
Okay.
Elmore.
Okay. Just thinking about maybe one or two practical points for everybody that's listening and tuning in. If you don't mind just sharing, like, if a person does need to go out, I mean, what do they absolutely need to be mindful of? I know wearing a mask, and we were talking yesterday about wiping down groceries, things like that.
Right.
Even actually, you shared some info with me about how and what the virus sticks to, the duration of that. I don't know if you mind just throwing that out there again for people.
Oh, yeah. Yeah. So, I think at the beginning, nobody knew, really much about this virus at all. And it's been very interesting to kind of follow along the evidence or the research that's been done. And obviously in retrospect, we'll have a huge amount of information to kind of go through to figure out, why did this affect some people more severely than others, or some countries more than others, and that kind of thing. So what we were talking about specifically was, how long does the virus potentially stay to the point where it could actually infect you on certain surfaces? And so fabric was not that long. If I recall correctly, it was about a day. Stainless steel was actually more than 3 days. So at 3 days, there was still recoverable virus. Plastic was the same, recoverable at 3 to 4 days. Copper was a very short period of time, just under 6 hours. And then cardboard was about 24 hours. So the interesting thing was that a surgical mask was actually one of the longest, scarily. So it was up to 7 days on a surgical mask that they could recover the virus. So anyways, yeah, I think it's, I don't know that we have to do this, but we've been disinfecting or using Clorox wipes or, something similar on our groceries. And then we've actually been putting, if it's something we don't need to use right away, we've been putting it in another room where we just let it sit for several days. And then hopefully by the time we're going to use it, if there was any virus on it, it'd be dead. So that's kind of what we're doing. And then one of the things that, we were texting about is that if you're walking around in a area where there wouldn't be a lot of virus, so say the grocery store, then you're probably not very likely to have that virus stick to your clothes and like carry it home. And it's a totally different thing if you're working in in the hospital in a COVID unit, especially, where you're probably having a significant amount of that virus, circulating in the air. And so that's a totally different situation. But if in a grocery store, it's probably unlikely that it would attach to your clothes. But if you're traveling, much more quickly than normal, say potentially running or riding a bike or that kind of thing, then it's probably more easy that if you rode by somebody that happened to have it and it was aerosolized, that it would stick to your clothes. And so, coming back from those kinds of things, probably best to just throw your clothes in the washer and just wash them right away. So other kinds of things, I think now is probably the time to minimize our risk of contact or getting it the most. So we are probably, like I said, close to our peak or at our peak maybe. And so that means that you have the most likelihood of encountering it in areas. And so whether that's the grocery store or other areas, and so really minimizing going to those places if you don't need to. Obviously, if you don't have groceries, you gotta get groceries. And if you want to get takeout to support your local business, that's probably a good, that's okay too. But do what you can to minimize, contact with other people. And of course, I think the wearing the mask and that kind of thing is decreasing the spread of the virus. So, and then really, until the measures have lifted, really avoiding contact with other people as much as possible, even family members and that kind of thing, at least in groups of more than 10 people. So this is really challenging. I know people, obviously are having birthday parties, stuff like that, or want to have birthday parties, and even if it's just a small number of people, but it's not worth it transferring it to a grandparent or something like that. So
yeah, really. Wow. So a good takeaway is to hear that word, that this is still a very dangerous time to be going out. Make sure you protect yourself. I would go with the motto, better safe than sorry. So do what you need to do to stay safe and to stay well. Any final thoughts for us, Dr. VERCIO, before we close up?
No, I don't think so. I thank you for taking the time. I hope this is helpful to the Crosswalk community. It's obviously a community that we care for deeply and privileged to be a part of, and I know you care for deeply as well. So thank you for letting me share this time.
Wow, we thank you so much, and we'll stay in touch with you to see if there's more updates. And so just stay tuned, Crosswalk, for more information like that. Be sure to share this if you find that it's helpful and could benefit your loved ones as well, even beyond our counties and our state. So thanks again, Dr. VERCIO. We really appreciate you. And everybody that's listening, we pray and hope that you stay well and continue to love well. All right, we'll see you soon.